Now, thousands of patients are harmed each year due to unsafe healthcare worldwide, resulting in millions of deaths annually in low and middle-income countries alone. But most of these deaths are avoidable. Today is World Patient Safety Day, and the major objective is to increase public awareness in healthcare safety and promote global action to reduce avoidable harm in healthcare. This year, the theme "Safe Maternal and Newborn Care" is aimed at raising global awareness on the issues of maternal and newborn safety, particularly during childbirth. The World Health Organization is urging all stakeholders to act now for safe and respectful childbirth. Joining me in this is Ehi Iden. He is an occupational health and safety management consultant. He joins me now via Zoom. Good morning, Ehi. Thank you for joining us on The Breakfast Show.
Good morning. It feels so good to be here.
Now, help us understand, when we are talking about patient safety, what does it mean?
When we talk about patient safety, it means within the circle of care, every harm that needs to get to patient ought to be envisaged, anticipated, and mitigated so that patients can come to our facilities with the whole aim of going back to their families without any form of secondary infection or adverse effect. When patients go through the circle of care within the healthcare system, many professionals within the healthcare system have access to that patient. But you know, the patient's intention is to run to healthcare system to have healing and to get cured of whatever diseases they may have. But most times they end up coming and living with diseases that they didn't come to the healthcare system. Some are harmed, medical error happens may greatly in the healthcare system, adverse event happens, and even patients have what you call nosocomial infection, or what you call hospital-acquired illnesses. I give you an example. Somebody that comes to treat, maybe was admitted for some ailment, and as the person was being discharged, and the person found out that he had chicken pox. Obviously, that is hospital-acquired illness, because he didn't come with chicken pox, but perhaps the room where the person was admitted, somebody who had chicken pox was admitted in that room, and the room was never disinfected before that person was admitted. So these are the kind of issues that we have that surrounds patient safety. Globally, it has become a key issue so that we can give not just the patient and patient's family that confidence that when the relative come to the hospital, we are able to manage them without any form of adverse effect or medical error happening within the circle of care.
But when you look at the Nigerian situation, would you say that confidence in the sector remains when we are talking about patient safety, especially with regards to maternal safety and perhaps the safety of newborn? We've had several incidents.
As a matter of fact, in Nigerian scenario, it's quite disturbing, because patient safety is not prominent in even the agenda of the government, or even the Federal Ministry of Health. If you follow development lately, there was a global action plan that was launched by WHO for 2021 to 2030, and countries across the world are taking content from that document and start domesticating it. And we've not seen this happen in Nigeria. We only talk about patient safety in letters. In the real sense, when it talks about practical experience or practical implementation of patient safety, it is really very difficult in Nigeria. And I think this is where it worries us all, because government need to have what you call even the guiding document, the roadmap for patient safety in Nigeria, policy document, and that we have not clearly seen. And when that policy document is not available, people don't know what to follow, because that is where we should all begin this in Nigeria. So a lot of issues have happened. People have died, people have been maimed, people have adverse events in healthcare system, and even most people who lost their loved ones. I mean, we had a lady in a program some time ago who was fighting for justice for Sean. I mean, who lost her child, I mean, within the circle of care. And you don't even know who to run to seek justice. I mean, and these are some of the issues that are very critical that we think we need to look into in our country. And if you look at the report, nearly 20% of global maternal deaths, I mean, happen in Nigeria. I mean,
right.
we need to look at it. That's not a figure that we should be happy with. We need to look at a way to step up our game in terms of management of maternal and child issues in Nigeria. It's still a big burden. I think everybody's hands have to be on deck on this issue, but the whole program should commence from the government's desk.
Right. Now, the question of experienced workforce, where does it come to play when we're talking about patient safety?
The truth is, that's very critical in patient safety, not just experienced workforce, because you might have been experienced in the process of giving injection or injection administration as you were taught in school, but there are safe processes to it. While we have experienced workforce, I mean, you will understand with me that patient safety is almost like a new concept in this part of the world. But you know, when you look at people that have been trained and they're experienced, it's high time we start making them to learn, relearn, and unlearn their old habits. Let's bring the concept of patient safety to those who are experienced. We're not saying they can't take delivery, yes, but what are the safe process of taking delivery? Mind you, a lot of things happen within the delivery cycle that nobody actually reports, and most times we just say, oh, it's one of the things that happen. We normalize it, part of the norms. But the truth is that most studies and researches in patient safety have brought out a lot of those issues are issues that are preventable. And when you start looking at those issues critically, and that's why, whether experienced or not, there is that immediate need, urgent need to make these people, I mean, understand the concept of patient safety, run them through trainings that are necessary to improve or add to their existing experiences so that the patients can feel comfortable and feel safe within the circle of care. But experience, yes, they need it.
Now, you mentioned something about a document that we haven't domesticated as a country. Now, how much of a game changer would that be if we adopt this document, especially beyond having to get justice on the part of the patient? What more would we be seeing changing?
You know, one of the things that's clearly put up in this document is patients' rights and workers' rights. And that's very crucial. So in this document, I mean, the right for patients, I mean, are clearly documented. I think that's one thing that we must praise this document for. And when you look at global patient safety approach, it comes from, that's what you call the international level, the national level, then the enterprise level. That's when you talk about healthcare system across countries. This is a robust document that was designed by experts across the world, reviewing issues that are prominent in terms of patient safety and harm that happen in workplaces. So everything that needs to be covered are covered in this document. In the document, it may not be everything that is there that may be applicable to our country, but it is important that we first look at this document, look at what are those things that are critical to our safe processes here in Nigeria, and start peeling them and reviewing them as they concern us, and start domesticating them. If we're able to bring those documents in and review and domesticate, it will go a long way in helping us, because it now let a patient know what his or her right is within the circle of care. It now let the healthcare worker also know what his or her right is within the circle of care. Because mind you also,
right,
the healthcare system is a workplace. It's primarily a workplace before becoming a place where we receive care. Even the workers that work in the healthcare system, they are also catered for in this document, looking at the safety of the healthcare workers, so that they also understand that yes, will be provided for, so that we can go to work with the hope of not being infected, and the duty of care from employer to employee is well put up, so that even the healthcare workers need to be kept safe, because you cannot talk about patient safety without first talking about the safety of the healthcare workers. So this document is robust, and if we can as a country look at it and adopt it, it will help us greatly.
But you know what, Ehi, a lot of persons will say that there are several documents that we have signed, but we haven't shown that commitment to ensuring that what we have signed is what we see, the results, basically. I mean, what do we do with regards to this? If we eventually sign this document, how do we ensure enforcement or implementation, as the case may be?
That's very correct. In Nigeria, we have seen a lot of policies being signed by governments, and implementation and enforcement of these documents become a very big issue. And that's where we also have a very great concern. I mean, even why we sign into conventions. I think what we should do is we need to realize it's not just to sign the document. It's to look at the content of the document and see how we can make the country, the citizens of this country, benefit from the provisions within this document. I mean, most of the conventions that the Nigerian government have been signatories to, most of those content of those conventions never see the light of the day in this country. We're quick to sign, but I think we should move beyond just signing and looking at those documents, repealing and reviewing it, making the content known to the general public, and letting every key actor, key player know what their role is within this document. It's very crucial because we've signed so much and we have seen so less being implemented, and this is a big problem, and which, of course, I mean, it doesn't fall within the ambit of advocates or and other people, but government. We need government to really be awake as it comes to this issue of.
But some would say that that is where organizations like yours come in, putting pressure on government, perhaps lobbying, as some would say, to ensure that we see implementation with regards to this. What do we intend to do moving forward to change the narrative?
We do that every day. As a matter of fact, I came to Abuja yesterday, and that's one of the things I came to do. I met with some key stakeholders yesterday, discussing these critical issues as it surrounds this process, and even the document as referred. And you know, the truth is that those who are also within the system also have some levels of frustrations. You talk to those you have to talk to. Yes, we push this document to push this process to a certain level. You know, there's just some clogs that you meet along the line, and they don't give priority to where priority needs to be, and it's just a key issue. And we find it difficult to understand if they really understand the system, or it's just a deliberate act just to undo Nigeria and Nigerians. And these are the issues. I mean, talk about advocates and other groups. Yes, we're pushing, we're engaging these people, we're advocating, but the truth is, I mean, it's just frustrating. It's just there's also a limit to which, I mean, you can also do, but we're doing that every day. But we need to get a good response from government, and this is where we're having all the frustrations as it concerns pushing for implementation of those processes and documents.
Perhaps we need to understand the implication of not signing that document, making implementations with regards to maternal and the safety of patients in general, not just maternal. Paint us a picture of what the implications could be if we are not pushing to see that we change the narrative with regards to the safety of patients.
Let me first put it here. Across the world, over 1 million children, their day of birth most times also become their day of death, and that's crucial. Nigeria is not left out. In sub-Saharan Africa alone, daily we lose 3,100 newborns within 28 days of their birth. I mean, we lose 3,100 newborns within 28 days of their death and of their birth. I think when we look at these figures that are coming out, this should be some of the things that will move us to sign this document. And there are heavy implications, which of course the government know. But this "I don't care" attitude, I mean, towards the public safety of the general public is what we're worried about, because this document is being implemented across many countries in the world. I mean, being domesticated, and they are having gains and benefits. We stand a whole lot of chance to have gains and benefits from these documents if they are clearly implemented. talk about, like I mentioned, the right of patients and the right of healthcare workers. One of those cases we gain from this document is, one, patients can leave their family, healthcare workers can leave their family, go to office, go to their workplaces without getting infected, having the right PPE to do their job. Compassion, empathy, apathy of care will be removed in healthcare systems. Responsibilities, of leadership, quality healthcare leadership become what we are looking out for in healthcare. These are some of the issues. Then we have what you call engagement, patient-centered care, quality of care towards the patients. And these are some of the gains that we have to benefit from these documents. And I think, except we say as a country we have no value for such gains. But for me, any right-thinking member of the society, we understand these values are enormous, and the need to work along these lines and sign those documents, not just sign them, ensure that they are implemented contextually into our system, will be a big plus and benefit to our great nation.
Ehi Iden, Occupational Health and Safety Management Consultant, thank you for your time.
My very pleasure.